Okay, getting a little bit more in depth with some different kinds of tissues, starting with epithelial tissue. Epithelial tissue is a protective tissue. We have it in layers on our body. Epithelial tissue forms the lining for the surface of your body, so your skin is epithelial tissue. Epithelial tissue lines the inside surface of your body. It lines your internal organs. Epithelial tissue is protective. It's meant to keep bacteria and viruses out of your body while keeping all the good things in your body that you want to stay in your body, like nutrients and water. If someone offhandedly referred to epithelium, they might be talking about the skin or the linings of the mouth or nasal cavity. Also, the inside of your ears is a ciliated epithelial tissue, meaning it's got little cells that are constantly waving like this to try to get rid of earwax. Epithelial tissue has little to no intercellular material. So here's my little drawing here of some epithelial cells. And you can see if you look at the space between them, there's not a lot of space between them. They're tightly packed together to try to keep bad things out of your body. Here's a slide that gets into different types of epithelial tissue. Don't worry about that. Don't need to know that. Never in your life as an SLP, probably, are you going to need to know about different kinds of epithelial tissue. But it does come up sometimes when we're talking about cancer. So moving on to connective tissue. Connective tissue, these are the kinds of tissue that are supportive, supports the body, the structures of the body. It binds the body together. It helps the body in maintaining itself. So whereas the cells of epithelial tissue were tightly packed and there was very little to no intercellular space, connective tissue is mostly intercellular material. The cells are spread wide apart, and there's a lot of stuff in between them. If you're talking about bone, for instance, which is a connective tissue, most of the space between the cells in your bones are filled with minerals such as calcium. All the stuff you get from drinking your milk when you're little. All those vitamins and minerals that go to give you strong bones, those strong bones are coming from all those mineral deposits that are getting put into the bones between the cells. Areolar tissue is a loose connective tissue. Really, what I want you to think of when you think about areolar tissue is adipose. And adipose tissue is the cells, the areolar cells in your body where your body stores fat. So anytime, if you've seen a surgery and the surgeon cuts through that layer of skin, that epithelium, beneath the epithelium, you're always going to see that layer of like white or yellow fat deposits. And that is adipose tissue. It is a form of areolar tissue. Also, we think about blood as being a connective tissue. That sounds counterintuitive, but blood helps the body maintain itself. So here under the definition of connective tissue, or aid in body maintenance. And blood certainly aids in the maintenance of your body. Your body can't survive without blood long at all. Seconds, maybe a minute. Because, for instance, the blood transmits oxygen. So think of blood as being a liquid connective tissue. You have the red and white blood cells that are floating around in the matrix of plasma. Getting into some specialized connective tissues, we're going to talk about tendons and ligaments. It's important to differentiate and know the difference between these two things. Tendons are non-elastic cords. They don't stretch, and they are always associated with a muscle. It is the thing that attaches a muscle to your body. So tendons attach a muscle to a bone, attach a muscle to cartilage, or attaches a muscle to another muscle. Looking at these images here, here's your muscle and these white bands that are connecting this muscle to these bones. Those are your tendons. Ligaments. Ligaments don't connect to muscle. Ligaments join bone to bone, cartilage to cartilage, or bone to cartilage. So your ligaments bind your skeleton together, bind your body together. Your visceral ligaments bind your organs together. These are floating around in your soft tissue. Your skeletal ligaments, which are the ones that we're mostly going to be talking about, bind your bones to one another. Whereas we mentioned that tendons, think of tendons as being non-elastic. They don't stretch. Ligaments have a little bit of stretch in general. So tendons attach muscles to anything else in the body, muscle to another muscle, muscle to a bone, muscle to a cartilage. Ligaments don't attach muscles to things. Ligaments attach bone to bone, bone to cartilage, or your visceral ligaments attach the organs within your body to one another. The next connective tissue, fascia. This is a sheet-like membrane that surrounds your organs and your muscles. It is a dense, fibrous tissue. If you had like a piece of fascia in your hand, it would be tough. It connects muscles. It binds muscles together. It helps organize muscles. So here we have looking at a slice of a muscle. And you can see that all these little red things are muscle fibers that run the length of the muscle. And there are groups of muscle fibers that are organized into functional units. And around each of those units is a layer of fascia. And when we're talking about the fascia that surrounds muscles, specifically, we call it paramecium. And this is an image of someone pulling the fascia up off of a chicken breast. So let's get into cartilage. Cartilage performs some very specific functions within the body. We have three different kinds: hyaline cartilage, fibrocartilage, and yellow cartilage. And they each have a specific function. But cartilage is unique because it has tensile and compressive strength. What that means is if I have a piece of cartilage, I can pull it and when I let go, it'll return to its original shape. I can squish it, and when I let go, it will return to its original shape. I can't do that with bone. If I try to bend bone to a certain point, it'll go, but then it'll break, and it's not going to return. Hyaline cartilage is also known as blue cartilage. This is very glossy. It covers articulating surfaces of some joints. It forms the framework for your trachea, the cartilages of your larynx, your voice box. That is blue cartilage. So if you're ever watching a cadaver dissection or a surgery of the larynx and they cut in, you'll see that thyroid cartilage, and it is blue and glossy looking. Also, your sternum is hyaline cartilage. The next cartilage we're going to talk about is fibrocartilage. And whereas hyaline cartilage is known for creating some smooth articulating surfaces and being important for the respiratory tract, fibrocartilage also creates smooth gliding articulation between joints. But fibrocartilage, we find that in our really big joints that have a lot of compression. So the discs of cartilage between your vertebrae, the cartilage in your temporomandibular joint, which is right here where your mandible articulates with your skull. This is a very powerful joint. You can bite really hard on things. So this is fibrocartilage here. The intervertebral discs, so the cartilaginous discs between your vertebrae. If you think about your lumbar, you have guys out there that can think of the weight that someone can lift. All that weight is resting on the fibrocartilage between the vertebrae. So those are very strong pieces of cartilage. Yellow cartilage is used in our body for the structures of the nose and the ear, and it's elastic. That's its primary feature. So if you pull your ear and let go, it will return. I can move my nose to one side or the other, and it will come back to where it's supposed to be. It will recoil. Bone is our hardest connective tissue. As I've already said, it has large amounts of minerals in it. A lot of these are inorganic salts. When you're an infant, all your bones begin as being more cartilaginous than bony. They're more cartilage, they're bendable. And this is good because this allows the baby's body to have a flexibility to it that allows it to exit the birth canal successfully. But that baby can't live its life with cartilaginous bones, right? So the older that child gets, the more minerals and inorganic salts get deposited into the bones. The more bony those bones get, the stronger they get, the more rigid they get, the less flexible they get. The purpose of bones is to provide support for your body, to protect your organs, to protect your soft tissue. A common disease is osteoporosis, which is the body pulling calcium and minerals out of the bones with age. And at this point in time in our country, pretty much once everyone reaches a certain age, especially women, they start taking big calcium pills, and that is to keep their bodies from pulling calcium out of their bones and creating osteoporosis. And basically what osteoporosis looks like is you don't know you have a problem until you trip and you fall and you break like 10 bones in your body. So it makes the bones very fragile and brittle. Joints are the connections between the bones and cartilage. There are different kinds of joints, but we're not really going to cover what they are. If you want to nerd out on different kinds of joints in the body, that's more of a PT/OT thing. And as I said, I'm not going to talk about things we don't need to know.